Thank you. Good morning, and thanks for the opportunity to speak. I think I ought to do a very quick run through why I'm speaking about health with no health background of my own, really. I am going to give a personal view of things, and I'll be drawing on a series of interactions with health that I have, and I'll explain those in a few moments. I'm not doing an academic presentation, that's not my style. It is about perception, and therefore some of you will disagree with some of the things that I have perceived because your experience will be different. And I'm not giving the views of my employers either. You will understand I'm actually politically restricted, and I'm going to avoid any too politically contentious remarks as far as I can. So I will run through my background in social care and how that gives me a view in particular on the relationship with the NHS and how we can draw lessons. And then I want to try and spend most of the time on the IG in the NHS, its current challenges and the lessons for the rest of us. So quite a lot to get through in 20 minutes. You'll excuse me if I rush. First of all, where do I get my viewpoints from? Well, actually, I have 7 different viewpoints on my relationship with the NHS. 4 of them are on this slide, the 4 professional ones. I work in local government in social care, in the adult sector, but I also have responsibilities in the children's services sector in local government, just the way the local authority works that I work for. I am a member of the UK Caldicot Council, so I do regularly have meetings and engage with other Caldicot guardians across the NHS and representatives from the other administrations in the UK, and get to hear and discuss some of the issues that relate to information governance and related issues. And finally, I actually work for the Information Standards Board for Health and Social Care 2 days a week, and that gives me a slightly different view, not all of it related to information governance directly, but certainly to information standards and their part in terms of accuracy of information, etc., that we need to use. So, something about the adult social care context. This is a massively simplified view of my day-to-day experience. The large blue block in the middle, adult social care, relating to a large number, far larger number than shown, of other organisations and services, both inside and outside the local authority. But by far the largest interface is with health, the large green block at the bottom. And if you follow round the others, which I would do normally in a different sort of presentation, I'd draw all the links to the various government departments with their own interpretations of what information governance means. So I sit in the middle trying to deal with compliance with the Code of Connection from the DWP, the Statement of Compliance with the NHS, and various other requirements that don't all fit comfortably together, but they're all based on the same law and meant to be the same practice. Children's services context is very similar, but the balance is slightly different in terms of relationships. Children's social care has a strong relationship with health, but an even bigger one with education, and therefore brings in yet more government departments and yet more interpretations of information governance. And as I say, my other 3 perspectives are as a patient, as a carer, and as a citizen. And all those views, I think, are relevant, and those experiences are relevant to some of the things I've got to say now. So, information governance in the NHS. Well, from where I sit from the outside, I've seen the policy framework for information governance that the NHS agreed at its NHS board, as it then was, in 2001, and seen that that stood the test of time. It's still as valid today as it was in 2001, and is in fact being reviewed and reappraised to see whether it's fit for the whole of the health and social care domain rather than just the NHS itself. That policy framework has led to various ways of looking to make sure that people comply with that policy framework, and one of the views of those is to have 4 areas of requirement: the management requirements, the people requirements, process requirements, and systems requirements. And one of the things I think is strong about the NHS is it tries to bring those 4 components into balance. Some of the experience I have sometimes elsewhere is that they're not balanced, and you can either get very focused on people or very focused on technology and miss the bits that join them together. The NHS has been very positive at trying to support its trusts at local level to know that they're complying or how to improve. And one of the ways it's done that is through the development of what they refer to as their Information Governance Toolkit. It's actually quite a complex toolkit. It can be used for self-assessment. How are you complying with the relative requirements? And I've identified, I think, 93 requirements in their toolkit. Most organisations like Adult Social Care would have to respond to about 50 of them. So it is organisational sensitive. It does vary according to settings. And they help you to identify your position in terms of conformance with those requirements by having 4 levels. 0 being basically you haven't even thought about it, through to 3 it's really well embedded in your practice and reviewed annually. Level 2 being overall the level where everybody can say, I'm pretty comfortable that I'm complying with all the policies, all the regulations, and ought not to fall foul of the law. So it actually is very helpful just as a self-assessment tool. But the thing I'm drawing attention to it for is because it's much more than that. The tool itself includes guidance and examples that can help you when you're struggling, even if you're from outside of the NHS. Sitting outside in local government, I've certainly drawn on examples there and retailored them for use in my own authority. It also helps you to prepare improvement plans. So if you're not hitting level 2 on the required requirements, it tells you how to do it, what evidence you'll need to do to satisfy the auditors that you really have achieved what you say you have on your assessment. So it seems to me that one of the things we can draw from the NHS is how it's managed to produce nationally something that can be used locally to help improve information governance. It's also produced online training tools. I'm going to be slightly more critical of those from my perspective. They're still relatively new and relatively limited in scope. But actually they're so dominated with professional health speak that when I try to use them in social care settings, it does raise hackles a little. I think some of those will change over time, but it is fair that they were produced and paid for by the NHS. The NHS has also, I think, very positively tried to help people to improve information governance by looking at the types of initiatives that improve it, and these are also can be drawn out through the Information Governance Toolkit. So instead of just having the requirements in management, people, processes and systems, we do have what is it that makes for good information governance management. How do we ensure we deal with confidentiality and Data Protection Act assurance issues, information security, particularly to the NHS, but very relevant to social care, is dealing with care records. How do we deal with those? How do we make sure the information is right? How do we make sure it's protected? How do we make sure it's shared? And then the overall corporate information assurance. Something I've got to say much less about in terms of the NHS, because I tend to deal with the personal and sensitive information side rather than the more corporate policy. As a Caldecott Guardian in local government, it would be remiss of me not to say that the idea is very firmly rooted in the NHS, started in the NHS about 3 or 4 years before it was brought into social services and has continued through into the social care regime now. Caldecott Guardians there to act as the conscience of their organisation in terms of how personal and sensitive information is dealt with, and on the things that don't quite fit the rules, exceptional cases, helping people to come to a decision what to do there and then, dealing with the practical day-to-day issues in a sense at the organisational level. And the way that's now supported through the Caldecott Council, the training programmes and other things that are gradually being developed and improved. Probably really wider than the NHS, in fairness, but nevertheless related, is the development of the National Information Governance Board, which is exactly what it says, for health and social care. It's another place to go for sorting out advice issues. It's also got other regulatory functions, and I don't want to say too much about that. There are some more expert people than me in the audience today, and other opportunities to discuss that. And then finally, as I mentioned, I also work for the Information Standards Board for Health and Social Care.